Lots more people than ever before are having video and telephone appointments now with health professionals because of the COVID-19 outbreak. So today we're talking about virtual appointments, how to prepare for them and get the most out of them. So we're here with Valerie Stevenson, who's a health professional, and she's going to talk us through some of her tips and strategies for making the most of virtual appointments. So first of all, Valerie, could you perhaps introduce yourself and tell us a little bit about your role in the NHS and what you do day to day?
Yeah, sure. So my name is Val Stevenson. I'm a consultant neurologist. I work at the National Hospital for Neurology and Neurosurgery at Queen Square. So that's part of University College London Hospitals in London. So I work with quite a lot of people with MS, but I also lead the rehabilitation service and the spasticity service at Queen Square and do a lot of functional electrical stimulation as well.
And can you talk a little bit about your experience of running appointments virtually? Because I know this is something you've actually been doing with your team before COVID-19 came along. So have these been quite successful for you and your patients in the past?
Yeah, it's a really interesting point actually, because we started doing virtual spasticity clinics about 10 years ago, and actually there was very few people doing them at that time. And we did a little piece of work looking at what this meant for patients and what this meant for professionals. And actually the feedback we had from patients was it was really, really helpful. They didn't have to travel, and a lot of our clinics were with people in remote areas of the UK. So we knew it worked. The biggest problem over the last 10 years has been the technology. And that's been really challenging because there was a lot of concern, and rightly so, about security because we're dealing with confidential issues. So there was very strict criteria and there was little support about making these work, and quite often the technology went down. So the one thing that the COVID pandemic has done has really, really focused healthcare resources, and there have been massive gains in how we run video clinics over the last 6 months. So we know it worked, and now we've got the opportunity to make it better with better resourcing and technology.
Brilliant. So it sounds like you're really experienced in this area already, and I suppose it's one kind of good thing that's come out of COVID is that technology's developed to allow us to do better with kind of virtual appointments.
Absolutely. I think it's allowed us to catch up with the real world, because video conferencing has been used a lot in corporate areas, but not so much in healthcare as a routine.
So if someone has a virtual appointment coming up, can you give us some tips for how they can prepare beforehand?
The first thing to say is that it's really important that you take this seriously. So it's exactly the same as any other appointment. And if you can't make it, you need to phone up and rearrange the time, because your healthcare professionals will have allocated that slot just for you, and it is a waste of NHS resources. So take it seriously. If you can't make it, do phone up and rearrange it. The next thing is to think about, have you got the right equipment? So you need to make sure you've got a quiet space so you're not going to be disturbed in. You need a computer, so either a laptop or a PC, a tablet or even a phone, but you need to make sure that you've got internet access, so either through Wi-Fi or a wired PC. And also that your equipment is not too old. So some of the platforms rely on you having at least kind of Windows 7, or I think it's the Mac, I think it's 11.1, but your healthcare provider will let you know. Also, you might need a specific browser. So for example, Attend Anywhere relies on Google Chrome or Safari. So if you're using an iPad, that's fine, or an iPhone, you'll have Safari. But if you're on an Android device, you need to make sure you've downloaded Google Chrome before the day. So make sure you've got your equipment, make sure you've got a quiet space to do that, and then make sure you do a test call. So your healthcare provider will send you a link, and a couple of days before, just make sure you can click on that, and there will be an option to test your video, test your audio perhaps, and just make sure that it does work for you. That gives you enough time to contact the team or the secretary, and they'll talk you through how to access it to make sure that it will work on the day. But there's nothing worse to leaving those kind of things to the last minute and then panicking. The other thing that's really important is to make sure that the team that are contacting you have your telephone number, because we all know that technology can go wrong. And if, for example, it goes down in the middle of the call, your team will phone you, but they need to make sure that they have your number to contact you on. So ensure that they have that. And then as it gets closer to the appointment, you need to make sure that you're prepared for actually what's going to happen. So, for example, as you would if you went for a face-to-face, perhaps make some notes about all the questions that you want to consider, any particular areas that are concerning you, so that you have that all ready, because it is a bit daunting and it is a bit different being on video. So the more prepared you are, the better it will be. And then thinking about the actual day of the appointment and the time, there's really, really simple things to remember. So, make sure you're on time. Go to the loo beforehand. You might want a glass of water nearby. Make sure the television is off. Make sure that your any other devices are muted so that you're not going to be disturbed by any noise. And make sure you have your glasses to hand if you wear glasses. A list of medication, and that's really helpful, because even if you struggle to perhaps read them all or to pronounce them, you can actually show the piece of paper to the screen, and your healthcare team may be able to take a photo of that, or will be able to jot down the details as you do it. So there's some really simple things to make sure you have to hand. The other thing I guess to say is if your appointment is with a physio, for example, or an occupational therapist, they might want to see specific bits of equipment. So if you wear a splint, have that ready. Wear comfortable clothes. Perhaps make sure you have some shoes on, so in case the physio wants you to walk, then you're able to do that. It's also worth thinking, if you're having a physio appointment, you might want to make sure you have some space behind you, and even think about the device that you're using, or have a friend or a family member on hand, so that if they want you to hold the phone or the tablet, then they can hold it whilst you walk and the physio can see more. So I guess it's just thinking a little bit ahead about what might happen and being ready for anything that could happen.
Brilliant, thank you. They're all really useful tips. So what about when you get into the appointment? It can feel quite different when you're talking to someone over video rather than face to face. But do you have any tips for people once they're in the appointment and talking to their health professional?
Yeah, I think it definitely does feel different, although I think we've all learned over the last 6 months that actually it's been a fantastic way to keep in touch, and you can do a lot more than you expect. I think what I would say is when you log on, try not to feel too anxious about it. The first minute or two will be introductions, and we'll be checking that everyone can hear each other. So what we always say is when you log on, it's good to wave and say hello, because that, it shows the other person the video is working and you're moving and that you're there. And also it allows you to test the sound, and they will do something similar. And then if either of you are struggling with sound, you can take that opportunity to turn up volumes or check that the videos are on and that you haven't muted by accident. So don't worry too much about feeling anxious that you're in the appointment and time is precious and you have to crack on. Just make sure that you feel comfortable, you can hear everything, and you can see the other people clearly at the other end. So that's the first thing. Don't worry about where you look too much on the screen. It is really difficult because you tend to look at the other person and maintain eye contact, but obviously that's not where the camera is. It feels really uncomfortable to look at the camera whilst you're talking. So don't worry about that at all. It's not important. Just look at the screen and look at the other person, and it will be a much more natural interaction. The next thing, as we probably, lots of us have learned, that it's really difficult if people talk at the same time, or interrupting each other can be difficult because you lose sound. So if the doctor or the nurse or the therapist is talking to you and you don't catch something, or perhaps the sound freezes, or things you just don't quite understand what's happening, and they're in mid-flow, sometimes using your hand as a signal can be really easy to stop them, ask them to pause, and just to recap what they've said. What sometimes happens is if you try and interrupt by speaking, they lose their train. They can't quite hear what you said because the sound takes a minute to catch up. So it's quite natural, actually. If you wave, they'll finish that sentence and then say, oh, sorry, is there something you didn't catch? So I think use your hands, use hand signals a little bit more than you would perhaps if you were in a face-to-face consultation. If the sound does go or the picture freezes, then try not to panic or worry. You can try to reconnect, but your healthcare team will probably do that for you. So they will, if they're struggling at their end, they will phone you and explain what to do next. Or if you can try coming out and reconnecting, sometimes going back into the waiting room, if there is one, such as an Attend Anywhere. But don't worry, someone will contact you, and sometimes it just takes a minute or two.
And what would you say to someone who's maybe feeling a bit worried or anxious about an appointment that they've got coming up?
Yeah, I think it's only natural to feel worried because it's something new, and it takes all of us a little bit of time to get used to that. I think the first thing that helps with anxiety is being well prepared. So taking the time to do all the steps we've talked about is really helpful. Tell your team that you're feeling a bit anxious. I think I would say at least, a third to a half of our consultations, people say, oh, I'm a bit worried about this. I don't know how it's going to work. And actually your team will reassure you and people relax into it very quickly. But remember, if you find that it's not for you, if you really struggle, there's nothing wrong with saying, actually, I really don't like this. Would you mind just phoning me and we'll talk on the telephone, or could I come in and see you? So, there are lots of different options and no one will judge you for feeling anxious. But I think most people will be really surprised at actually how good it is.
Yeah, there's so many positives to it. It's amazing what can be done virtually now. So the final question is, are there times when virtual appointments maybe aren't appropriate? Is it still possible to see a health professional face to face?
Absolutely. And that's really, really important to remember. I don't think any of us would want to go to 100% remote clinics. It's a great resource. I think it's here to stay and I think it's got a real place, but it doesn't change the value of a face-to-face consultation. But if at any time people have anxiety about that and wish to have a face-to-face assessment or a check, perhaps with a therapist or with a doctor, then just tell your health teams about that and there will be ways to make that happen. And of course, when you do have that, the team will make that as safe as possible for you. We cannot eliminate all risk, but hospitals are really well set up now. Everybody's wearing masks. Your team will be wearing an apron, gloves. They will be seeing people in socially distanced spaces. Everything is cleaned between patients. So the risk is minimized and people are very aware about how best to keep everybody safe, both patients and staff.
That's really reassuring, I think, to hear for people that they can still see someone face to face, and also that steps are being taken to try and minimise any risk as well if you do go into a hospital environment. Thank you very much for all of those tips. They're really, really helpful.
That's okay. I think the last thing I would say is if you're feeling really anxious about this and you're worried and you don't want to do it, or you think you need a face-to-face, there's no harm in giving it a go, because quite often we can do a video assessment and say, you're absolutely right, we need to see you face-to-face, but we can cover quite a lot of ground and assessment so that when we do see you, we can use all the allocated time to do the treatment and the assessment, and we don't need to spend time going through all these details. So I would really urge people not to think of it as a waste of time. It's never a waste of time. You'll always get something out of every consultation, and even if you do need to come for a face-to-face following it, you've covered loads of ground and you've saved time so that you can make the most of the time that you have with your therapist or doctor and get all of the background information done first.
Brilliant. Thank you very much. All really, really useful stuff, which I'm sure lots of people with MS will find useful if they've got appointments coming up that they may be a little bit worried about.